Oh, it's a great honor for me. I'd like to thank everybody that recommended me, all the support that was given to help get this nomination. And I think it's a wonderful thing to recognize this many people in healthcare.
You've been at the state hospital for a number of years now. Tell us your story real quick, just how you've transformed that department.
Okay, well, basically I started there about 38 years ago. And when I started, it wasn't any security. It just had what they call gate guards. After I taken over and everything, we started sending people through the law enforcement academy. I was already a graduate of the academy at Advanced Military Police Academy. And we led in the top 5% #1 graduating officers back in the 1980s. And since that time, we advanced from 13 officers to 57 positions. We train our officers in lots of specialized schools. They graduate from Mississippi Law Enforcement Training Academy, which is 10 weeks, 400 hours of academic field training. And we've turned out some great officers for us and for other departments.
Different officers coming out of the academy, do they want to come to the state hospital? Do you have to recruit, or?
We recruited for a number of years. We never did even post a position. Everybody came. And in 1999, I had over 500 years of state service in our department. And then shortly after that, we started having people getting their years of retirement in, and we started retiring. So we've been trying to build the department kind of back up. We do medical transport. We do fire. We have to be cross-trained in that. Also have some guys on the county-wide SWAT team. They can respond to anything we have at the hospital, or they can respond countywide with all the other law enforcement agencies. It's been an enjoyable place for me to work. I didn't really think I was going to probably be able to work there when I started. I've always been pretty tender-hearted. I'd been in the military, and I was going to school on GI Bill, and I got pretty well attached to the patients. And during all the years I've been there, my wife and I basically adopted a patient that was brought up when he was 17 years old, and we bought him everything he needed, his clothes, spending money and all that. And during the 55-year course that he was at the hospital, nobody never came to see him. When he died, I coordinated his funeral. We had about 80-something staff members at the funeral. We got him a tombstone and everything. So it's been a real blessing to me to work in that environment. And I tell lots of people, you see somebody sitting on the bench, you don't really know anything about them, but when you sit down and start talking to them, you can learn a lot.
You can make a difference in their life.
You make a big difference. And most of the time, I just want somebody to sit and talk to them.